One sign of abdominal wall weakness or motor control issues involving the abdominal muscles is something we call doning, coning, or bulging. This is during activities where there is an increase in the amount of pressure inside of the abdomen. This includes exercise like sit-ups, crunches, planks, lifting, bending, daily activities like rolling and getting in and out of bed, standing up from a chair, pushing, pulling, things like that. And what we're looking for is a bulging through the abdominal wall, which is really the organs in the abdomen, most likely the intestines, pushing through the connective tissue right in the center called the linea alba that has become stretched and separated due to pregnancy and may not have returned to its normal length in the postpartum period. So I'm going to demonstrate what doming and coning looks like. So one way that you can check for abdominal doming or coning is to lay down on your back and do essentially the same test that you'll do to test for a diastasis, where you lift your head and chest off of the ground. As you lift up, you can see there's a doming or coning happening right in the center of my abdomen if I don't activate my abdominal muscles correctly. This can be seen during things like bridges as you're shifting to move in and out of bed. It can happen during rolling. It can happen as you're pushing up. And those are the times that you're really looking to see if this is happening, because if you are having any doming, then that's an activity that you either want to avoid or learn how to use your abdominal muscles correctly. If I try really hard, I can engage the deepest abdominal muscle called the transverse abdominis. And as I hold that engagement, lift my head, the doming is much less. I'm going to go through what doming or coning looks like in a plank position. So if I go into a full plank on hands and feet, and I'm not engaging my abdominals correctly, you should see some abdominal bulging as my abdominal wall is dropping. It's really the organs that are dropping through the abdominal wall. If I engage, which means pulling my belly button, drawing my abdomen in towards my spine, I can lessen that. And at this point, it still actually looks okay. I'm sure as I get bigger, that is going to change. But I still at this point would choose to modify, which would be a plank on hands and knees. And then it's much easier for me to draw my transverse abdominis muscle in to keep my deep core engaged and protect my abdominal wall from the organs being pulled down towards the floor.